guys. Hey, happy Labor Day, everyone. Thanks for joining me on Test MD TV. My name is Dr. Tess Washington, board certified physician and surgeon, and on this channel, we focus on the optimization of your looks, love, wealth, and health. And tonight, you're hanging out with us for our Monday night broadcast, hangout. It's supposed to be a book club. We finished a book about a week ago. We haven't picked a new book yet. So now it's just discussing topics that are relevant to my brand and that I think what you guys will get a lot of information out of. Let's just discuss things like that. So consistency has been so difficult for me because like I say in many other videos, YouTubers make this look easy. And when I was in the hospital and I was looking forward to like getting some time off when I could finally just kind of like film, I was like, oh man, I'll be able to do like they're doing. I'll be able to have content on a regular basis. I'll be able to produce. But the most difficult part is showing up, because let me tell you how many things come up along the way. Everything. But like my grandfather used to say, I was raised in the Baptist church, and he used to always say, y'all gonna play like y'all got Holy Ghost, and one day you're gonna actually have it. And now taking that into current times, I think what my grandfather was saying, you could play in an area, but eventually if you stay in that area, you're going to get serious. We can think about some relationships that we've been in that we thought we were just hanging out, dating. Next thing you knew, you're married to person, right? It turned into something that you didn't expect. That's how this social media experience has become for me. I got some followers that are diehard. And if I don't show up, I feel like, I got to show up because I know that they are depending on me. And I want to set a positive role model. I want to be a positive example. Like Oprah said, if I'm a influencer and all I do is do what I say and show up on time, something's going on wrong, right? And unfortunately, the kids really don't have many role models or people who they will like, this person's doing this, so I'm going to do it too. So I try to practice what I preach. And now this YouTube channel, I wouldn't care if I had to go through like a hailstorm, or if I was even at the hospital and I had to pre-record. This Monday at 6 p.m. Pacific is etched in stone on this channel. Now, anything else, I can't necessarily commit, but this is just a part of my life. And I'm very proud to be able to continue this commitment. Going live, the mailing list, responding to my followers, being there for them. It becomes more than just fun and social media. It becomes like an obligation. And, especially since I don't have any children, they're my children, you're my children, and my word has to be my bond. So that is where I am with regards to this whole YouTube experience. Now, discussing Sarah Harding, the reason I wanted to discuss this beautiful young lady who recently died, as of today is September 6th. So she died September 4th or September 5th. I'll make sure I put the correction down in the description. But if I read it last night, so she died September 4th. And if I'm wrong, leave the correct date in the comments. But she was 39 years old. And the reason why I felt like her situation was so unique is because I read a lot of information and a lot of interviews that she gave prior to her death. And she said that during the pandemic, just like 2020, not too long ago, she felt something on her breast, and why should you stay to the end? Because I'm going to give the 8 symptoms that Sarah Harding said that you should never ignore when it comes down to assessing yourself for possibly having breast cancer. Now, sit back down, listen to me a little bit more. But She was just stating that she thought that it was just like a cyst, and she felt something, but and she called it COVID fear. She said that she was using the excuse that she didn't want to go to the hospital. The hospital needed to be occupied by people who had COVID and who needed ventilators. She would just be in the way. And finally, she started to notice a discoloration of the skin of her breast, and the pain was excruciating. Not a pain that you could just write off and say, yeah, it's a cyst. It could wait until after the pandemic. And she stated in one of her interviews, let me just get a hold of myself. Stop it. Get on top of yourself, Sarah. Go to the doctor. Stop making excuses. And when she went in for her initial evaluation in 2020, the cancer had already metastasized. All right, that's a test. Stop using big words. What does metastasize mean? There are various stages of a cancer's growth. At some of the earlier stages, it's just like an isolated, we could resolve the cancer with just like a lumpectomy. When I was doing my training at Cedars-Sinai, I spent a lot of time on the breast cancer rotation, and we did many, many, many lumpectomies. We can use this dye in order for us to find the sentinel node, the lymph node in your axillary region, where probably it would even let us know if it's spreading or, because what we don't know, men too, is that your breast, even though we see a significant part of it in the front of our chest, it extends all under your arm and into your armpit, which is huge. So by the time she went in to be evaluated, it had already spread from just the isolated area where it originated and to different organs in her body. And this news was absolutely devastating. Sarah Harding was diagnosed August of 2020. Okay, let's all count with our baby fingers. August, September, October, November, December, January, February, March, April, May, June, July, August. So basically, that's 12 little fingers. So a year and some change. She's gone. Now, let's talk about what she went through after she was diagnosed. So Sarah was diagnosed August of 2020. After she was diagnosed, they quickly initiated her on chemotherapy because, as stated, she already had metastatic disease. When she was about to go to her first chemo treatment, her port was infected and she had to be admitted for sepsis. What is sepsis? Sepsis is when you have a bacterial infection that has gotten to your bloodstream, and at that point it's called bacteremia. But when that same bacterial infection has gotten to your bloodstream and has spread to an organ, it's called septicemia, i.e. sepsis. So there's a criteria that we use where we determine if someone is diagnosed with sepsis. So that means that she had a gnarly infection prior to even starting her chemotherapy. Now, here's the thing. When we have a cancer patient who has sepsis, that's a really big deal, because mainly their immune system, they're almost helpless because the cancer has predominated. And normally when they're going through therapy, the chemotherapy decreases their immune system even further. She hadn't even started her chemotherapy. But what this does mean is they had to hit her with some broad spectrum, heavy hitter antibiotics. And you cannot go through chemotherapy with a pre-existing infection. So that meant that her chemotherapy had to go on hold because we had to fight and resolve the sepsis. So once her sepsis was finally resolved, she did initiate chemotherapy. However, with it being her cancer was so aggressive, the doctors and the surgical team had to be aggressive as well. Therefore, she also had to undergo a total mastectomy, which was devastating. Have you seen her? She's beautiful, and just so prior to all this, she was just sitting at home like everyone else, shelter in place, dealing with the pandemic. And then next thing you know, she's getting chemos and she's in the ICU with sepsis, and now she has to get a total radical mastectomy. After the mastectomy, she continued with her chemotherapy and she remained very, very, very optimistic. And her personality, her energy in her articles and her interviews was just like, man, I got this. I got this. I'm gonna beat this. Cassie, you ain't got nothing on me. I'm gonna beat this. Unfortunately, as time went on, additional masses were found. There was one that was found, according to one literature, in her spine, and then there was a possibility of one being found in her brain. This means that basically the cancer had jumped on the lymph node superhighway. And, we always talk about our tonsils because those are two lymph nodes that we can see. And we know that Mr. Spleen is a really big lymph node as well. We kind of know about that. However, we literally have lymph nodes from our tonsils to our toe, and they're kind of connected on this cord. And it is kind of like fire on paper. Once something jumps on one, it shoots down through the others. So at a point, she pretty much became palliative. In other words, comfort care only because the cancer had metastasized. And one doctor stated to her in one of her articles that she wasn't going to see Christmas. And unfortunately, she didn't. She didn't see Christmas. So I was so sad. I mean, this woman was incredibly beautiful. She was talented. She's very well known of a girls group that she was in called Girls Aloud. Beautiful voice, just a songstress, just most likely to be most likely, everything in the world going for her. So why am I mainly discussing this topic? Because we don't go to the doctor. There are so many preconceived notions and thoughts and multiple legitimate reasons why we justify not getting preventative care and wellness evaluations. I don't have insurance. And these are all reasons that I respect. I'm not saying that they're excuses, but I do want to put something on your mind when I get finished going down my list. I don't have insurance. I don't have time. I don't have a primary care doctor. I don't know a primary care doctor. Here go the best one. I wouldn't have cancer. It doesn't run in my family. Or I don't have any pain. And even though those may be very valid excuses, they can't be used because cancer, it used to be, breast cancer. Breast cancer used to be a cancer that was a death sentence. And now, based on the advances of medicine, it's kind of not. And early detection is key when it comes down to breast cancer. And preventative medicine, routine examination, going to the doctor if you ain't sick is annoying. And the reason, I agree. Let me go ahead and let me just bring this home as to the relevance with me. You guys all know about my tooth abscess. When I was in the military, I was at the doctor. I didn't have a choice, or else I would be grounded. I was a flight surgeon. I wanted to fly, so I did everything. But when I got out and when I became responsible for making my own decisions, let me tell you what always got put on the back burner: going to the doctor. And it wasn't until I got that severe tooth infection that I was like, God, please, if I make it out of the please. And I didn't even really want to go when I went. And that oral surgeon told me that my infection was so bad, if I had waited, he would have had to do surgery on my face. And I just felt like that scared me straight. And with our schedules, no one has time. But here's the situation: you have to make time to take care of yourself, because you could use Dr. Google, WebMD, anyone you want, but these things cannot see inside of you. And these things cannot take labs, and these things cannot evaluate you. And in our current society, we are more prone to a lot of the malignancies because we're constantly at a state of cortisol whoop, on 25,000. Okay, we are taking in estrogen in so many different ways, through plastics, through cans, through the dry cleaning plastic, just uh, just so many different ways. We don't know what hormones are in the hamburger or the chicken. We don't know how these animals were raised, or we don't know the pesticides or anything that has been sprayed on the fruits. We don't even know what's in the air, the environmental toxins. There was one literature I read that discussed that the jury is out, but there's a thought that HER2 cancer, and that's a certain marker that a breast cancer has, is thought to be secondary to environmental toxins. And we're not really having kids and getting married like we used to. And one of the thoughts that does put you more so prone or at risk of cancer is hormonal imbalance, not having children, which means that your estrogen and progesterone fluctuate for a longer period of time because nothing's interrupting them. No one's baking in the oven. So just the foods, our lifestyle. If a cancer ever wanted to have a field day, we would be an amazing population to be prayed. And just look at what we just went through as far as dealing with the pandemic. Do you know anyone who's ever spent a year in the house? I don't. So, how do we know the sequelae? After that dental abscess, everything just became surreal. All the things that I was so busy doing, all of a sudden, did not become as important as just picking up the phone. Yes, I'll hold. Okay, yeah. You need me to be there how long in advance? I gotta get a ride? Oh, God. Just do it. Just do it. Just do it. Now, regular health maintenance, does that necessarily prevent the possibility? No. However, it does put you in a very strong category of early detection. Just briefly speaking on some of the other literature. Oh, I got to tell you the 8 things that she said. Just briefly speaking on some of the other literature. Family history. We're like, well, we have cancer in our family. Well, according to the literature I read, that is possibly an additive risk, but that's not necessarily a specific guarantee. If your mother had breast cancer, you're definitely going to have breast cancer. Not necessarily. Okay. However, a lot of high fat in the foods that we eat, because we know that Mr. Estrogen, no, Miss Estrogen is a miss. Some of the hormones are miss, some of them are Mr. Like testosterone, he's a Mr. Progesterone is a miss. Yeah, it's all in my mind. But estrogen loves fat. She loves it. She just loves it. So the fluffier you are, the more estrogen wants to come over your house and stay for the entire summer. So that's the reason why exercise and weight loss is such a big deal as far as keeping down our probability of getting a malignancy that we just really probably would prefer not to have. So I'm going to go ahead and cut straight over and just discuss the 8 things that Sarah Harding mentioned that we should always pay attention to and not ignore, because they just may be signs of a breast cancer that we may want to seek immediate medical attention. One of them, of course, is a lump. And also the guidelines, we don't necessarily recommend people to do home breast exams. However, I cannot tell you how many patients have come in and they stated what led them to come in is they felt a lump. So, all right, the guidelines are one thing, but you doing you is another. Do whatever you can do to make you feel safe about yourself. So if we palpate a lump, if we have an indentation of our nipple, if we have a discharge from our nipple, if we have a breast pain, if we have a thickness or a discoloration of the skin around the breast, if the shape of our breast is abnormal. The guidelines state that we should start being evaluated per mammogram around 50 years old. There's other literature that states if you do have a family history of breast cancer, from the age that the person was diagnosed and or died secondary to the breast cancer, you should start to be evaluated 10 years prior. So, for example, my grandmother died of breast cancer. She died at 52 years old. Therefore, me and my family should start getting evaluated at 42 years old and moving forward. You also may want to get your breast evaluation at the same imaging center so that they can compare your future images to prior images, or obtain a copy and take them with you if you do go to a new imaging center. And the ultimate thing that Sarah Harding shared and that I share is do not fear knowing, because knowing is your power. Because I got to let you guys in on a secret. Just because you do like this, that doesn't mean that something is not standing right in front of you, right? So don't fear knowledge. Think as a stoic. I understand that I'm going to go in, I'm going to get this test. The test results may be positive or they may be negative. Whatever the test results are, I'm strong enough to deal with them, and I know I'm positive enough to have a positive outcome where my confidence and my positivity will prevail. All right, if you enjoyed what we just discussed, go ahead and give me a thumbs up, like the video, subscribe, stick around, let's be BFFs. Don't forget to click the bell for notification so that you know the next time I post a video. We're guaranteed to be here on Mondays at 6 p.m. Pacific. I'm Dr. Tess. Thank you so much for stopping by Tess MD TV. Have an amazing day, and I'll see you at our next broadcast. Take care.